Welcome to Shaping Healthcare, a podcast by CitiusTech. Some of the great minds in the world are constantly striving to solve the healthcare industry's greatest challenges with technology, creativity, and agility. With every episode of the Shaping Healthcare podcast, we will take you deeper into the world of healthcare and life sciences and give you a perspective into what it takes to build a human-first, technologically enabled healthcare world. I'm your host, Laurel Rockall.
Joining us today is Deepesh Hansrajani, AVP MedTech and a distinguished Principal Architect at CitiusTech with an extensive background in shaping innovative healthcare technology solutions. Deepesh's impressive career spans over 18 years, with a notable tenure at CitiusTech, where he has significantly contributed to advancing digital solutions for healthcare. His expertise in areas of product engineering such as solution architecture, cloud technologies, and agile methodologies has made him a vital force in delivering cutting-edge solutions that drive efficiency and improve patient outcomes. In today's discussion, we dive into the complexities and realities of infusing AI into healthcare applications. Deepesh will be sharing his insights on the challenges and opportunities that come with implementing AI technologies and how they can be effectively integrated to improve patient care and operational efficiency. As we navigate the intricate landscape of AI in healthcare, Deepesh's expertise will shed light on practical strategies and real-world applications that are shaping the future of healthcare technology. Deepesh, welcome to the podcast.
Thank you so much for having me today, Lauren. And thank you so much for an illustrious introduction. I will certainly borrow some of that from my LinkedIn profile, which is way overdue for something fancy.
Perfect. Well, it's well-deserved, and it's such a pleasure to have you here. Thank you for taking the time to sit down with me today. You've had certainly a long and successful career in healthcare technology, as I mentioned, over 18 years. So what initially sparked your interest in this field, and what's been the most rewarding aspect of this journey so far?
So, my initial interest in an opportunity with CitiusTech, which came about, 8-9 years back, honestly came from my realization of spending almost a decade of my life with my first employer. And the fact that I needed a change of scene. Truth be told, I started my career in healthcare tech with a naive understanding of what I was getting into. CitiusTech was not a brand as big as now. But I think something clicked. The people that I interacted with during my hiring process, the enthusiasm and passion towards technology and healthcare, I think that rubbed on my shoulders big time. I was a technologist, having worked extensively in US insurance back then, and I identified myself and took pride in the technologies that I worked with. But with my time at CitiusTech, I gradually realized what I was contributing. It wasn't just about technology or enabling a customer with software solution, but somehow I felt it was affecting me personally as well. With my aging parents, every diagnostic procedure, every surgery they had to undergo, I could appreciate what technologists like us with deep domain inclination make possible in the medical technology space today. And I believe, this has been the most rewarding part of my journey here. I feel the work, I'm doing along with my colleagues here is eventually making a difference to my own life and my dear ones, and of course, the larger population.
Yes, I can absolutely see how rewarding that is. Healthcare is such a deeply personal thing. It's like healthcare is for everyone. And I feel like whether it's been us personally or someone we know and love, everyone has been has been a user, and impacted with healthcare and being able to contribute in a way that is making lives better for people. I think is wonderful, and of course that's a very rewarding thing. And what a great journey you've had so far. And as you mentioned, like healthcare, like going into it maybe a little naive and realizing over time how huge of a field this is. And that's a bit of an understatement there, but it's such a massive field for, everybody. And there's a lot of buzz, when we look at healthcare and then we look at technology, two big fields. And there's a lot of buzz of the combining of these two with Gen AI and AI technologies and how much it can revolutionize healthcare. How much of that buzz is real, Deepesh?
the buzz is deafening for sure. It's louder than like 1,000 bees around you every single day. I don't think a single day passes without us, talking about our AI and Gen AI coming up in a conversation. And AI is already revolutionizing the healthcare realm. But the potential impact of what Gen AI has to bring about, it's like the iceberg under the sea, yet to be experienced. I must admit that AI and Gen AI has penetrated and already caused far more disruption independently, and I mean in a good way, in industries other than healthcare. You think banking, and AI is making fraud detection more and more powerful, making our banking safer. Or heavy industries, right, with all the automation becoming smarter, more reliable, more independent by the day, where we don't have to, necessarily rely on human supervision or approval, right? Or you think about retail, right? Highly personalized now. Again, leveraging a lot of this, right, which at times becomes a little scary too. And the list goes on, right? On the other hand, healthcare has been the most cautious in its adoption of AI and Gen AI, as it ought to be, because the price to pay if anything were to go wrong could be a human life. But here's the irony, and something that perplexes me as well. According to a study by Johns Hopkins, just this year, 2024, human medical errors are the third leading cause of death in the United States. And just in the US, estimated at more than 250,000 people every year.
Wow.
Now, that staggering number itself is challenged by many. And, they believe that this is easily north of 450,000. So, with that number, but on a lighter note, it makes me wonder how much worse could AI or Gen AI be for healthcare after all?
Right. And potentially the help that it could be in bringing that number down too, and helping to assist practitioners. And so what would you say then is the current state of the use of AI and Gen AI in the healthcare ecosystem?
Yeah, so we have to look at this in two parts, right? If I think of traditional AI, so AI has been around for many, many years, as compared to the infancy stage, as I call it, right, of Gen AI, especially in health. AI has made its way into some significant, impactful areas of, say, medical imaging, disease diagnostic, treatment planning. In the life sciences space, it's cutting down on the drug discovery and research time big time, right? In the clinical space, you think about a clinician's journey, right? The whole clinical note taking or remote patient monitoring, appointment scheduling. These are like, some very prominent use cases, but there is a huge list. And just to go deeper, right? Let's just think, robotic surgery for that matter. AI today is part of the entire life cycle, from, a surgeon doing pre-operative planning to, intraoperative guidance and robotic surgical assistance that's needed, and to, post-operative surveillance. AI is really, meaningfully reducing the burden of the surgeon and its team and letting them focus on the most complex tasks at hand, right? But Gen AI, despite its potential, is yet to be widely adopted, especially in the healthcare mainstream, given the scrutiny, in its limitations and ethical concerns, right? We are already seeing Gen AI being leveraged in a lot of standalone, administrative and, peripheral use cases, which are like, not mainstream, but, things like patient chatbot or, administrative assistance in revenue cycle workflows, from claims pre-authorization to prediction of claims, rejections, denials, and many such, right? Mm-hmm. But what I truly believe, what the future holds for us, and where, Gen AI will really shine in the future, is with a deeper integration with core healthcare product workflows, in a way that makes the larger healthcare workforce much more productive and far less fatigued, the way I look at it. Right? I consider that Gen AI is an infusing technology. Okay, it's not something that is standalone, just like what it used to be with cloud, as a technology. It took years for it to penetrate and become mainstream, right? Now, although it's not going to be the case with Gen AI at the rate at which it's moving, but it'll become more and more prominent and impact more and more user journeys in the healthcare applications over time as it really infuses itself in the mainstream.
Mm-hmm. I want to pick on a word that you've mentioned a couple times in that answer, and that was the word infuse. Can you explain a little bit further what you mean by infusing AI or Gen AI into healthcare apps, and what are the opportunities that would come out of the use of this when it's successful?
Yeah, and I'm very deliberate in using that word, infusing, like I said, because these are technologies that are enablers, right? Enablers of what exists or what we are yet to see. And it takes time before it matures in the ecosystem, right? So let's think about it this way, right? Whenever, and I'm sure you have talked to a lot of leaders and professionals who are working in the AI and Gen AI space for many, many years, right? And I don't call myself somebody who's an expert in that space, although I've been doing a lot of application engineering, but I'm also trying to catch up with Gen AI and AI. But whenever you hear about Gen AI, which is a lot these days, if you imagine a word cloud, right, where you see these big bold words that stand out, you will see, large language models, of course, right? Vector databases, data quality, trust, RAG, training, models, etc. Right? These are the ones that stand out in that word cloud. Mm-hmm. And of course, the core problem is really if we can build a Gen AI system with the desired quality of data and trustworthy results, right? And this absolutely needs to be proved out for. However, what we don't hear much, and at least in the early concept stages and phases, right, is about the application or the product impacted. That will eventually expose the feature, which we build using these Gen AI services, for our end user. Mm-hmm. The intricacy of integrating this in, very complex enterprise-grade healthcare applications, which, that have existed for many, many years and evolved over time with their current state of, how extensible they are or how stable they are. The overall user experience and the journey, I believe that is underestimated, right? And Gen AI standalone is good for standalone use cases, but the real impact and value will be, seen when it seamlessly blends into, the core workflows of existing healthcare products, be it the EMR, EHR, I can think of payer provider contracting systems, collection systems that help us, intake patients and, the apps that provide therapeutic insights connected to medical devices. And, Gen AI will just make them more and more intelligent and productive for the clinician, for the caregiver, for the patients that use it. And one important thing that I strongly feel about is that all these systems that I mentioned, they have a different appetite to integrate, AI and Gen AI based on, how legacy or modern they are, whether they are monolithic or modular when it comes to architecture and design, because these are the systems that your end users are using day in, day out. And you have to carry forward and enhance this experience for them, right? So, I strongly feel that, infusion is the word because some of this requires modernizing, redesigning, refactoring, rethinking of the core healthcare systems, which will happen over time, and Gen AI will catalyze it. And somewhere in the future, I feel that it'll be hard for us to distinguish, right, between a traditional healthcare application and a Gen AI application, as we tend to call it these days. And I expect that the adoption will move further and faster with cognizance of the existence of Gen AI and the impact that it can bring from decisions by regulatory bodies. Right. For example, I would like to actually quote this. Right, exactly a month back, EU rolled out the AI Act, first of its kind, and this will potentially, for a lot of people, if for starters, will be a setback. It'll pull them back where they'll have to think about a lot of things and classify their Gen AI, into high risk or medium risk, acceptable risk, all of that classification. But I think this step back will provide the required propulsion for the future. And this space, will mature further.
Yes. Very interesting. I'll have to look further into that law. That sounds really interesting, and providing a framework too for, how AI will grow in that space. And just a small, personal experience, I should say, with AI in healthcare. I recently was at the dentist, and the dental hygienist was thrilled about the new AI programs that are infused with what they're doing in their work. And she's like so happy about the ease of the note taking and being able to flag things and being able to keep an eye on things. And I was like, I've had conversations with the people that design these programs. So she's very happy about it. But it does. It certainly sets up a bright future, exciting, and how that will shape healthcare going forward. And of course, with the excitement and the buzz and the great opportunities, the flip side of that coin are the challenges. So what would you say are some of these challenges when looking at Gen AI enabling with healthcare apps?
Yeah, I think there are significant challenges. And, I can say that there are different types of challenges that in themselves are, different categories that need to be dealt with. Right? So what I must say that, all these administrative use cases and peripheral use cases where you may not have a direct impact, on a patient's life, where probably hot potatoes for POCs with Gen AI, right? And actually taking them to, live production, applications. But core healthcare product workflows, that basically provide or enable healthcare professionals to take decisions for their patient that directly impact the quality of care and the patient outcome, make it far more regulated and scrutinized. The most substantial step in making these healthcare products more intelligent and autonomous will come by leveraging Gen AI in the core workflows, like I said. Right? Now, navigating through the regulatory landscape, the EU AI Act is one step where at least there is some definition. And now we know what we can't and can do, and how do we kind of evolve that? Modifying proven workflows that have worked for us for many, many years and evolved, over time, not as fast as, what we are seeing with Gen AI, right? So ingesting AI, Gen AI, without disrupting or degrading our user experience, right, is key to adoption. And having just the right level of human in the loop, right? Whenever we talk about AI and Gen AI, we talk about human in the loop. So, we really need to calibrate on what's enough and what, something that may be overdoing it, right? For us to tap into the real potential. So a lot of these healthcare applications may not be as extensible, and making any intrusive changes may not be an option at all. You could be dealing with applications that are 20 years old, may have evolved over time, but, it certainly requires steps to modernize and refactor these products before trying to load them with Gen AI capabilities, right? If we want it to be sustained and really adopted by users, right? And to be able to, build out working software, another challenge that I see, right? End of the day, there is concept, there is ideas, but now you need to make it a reality, with a working software. So what do we need to make it happen? So here we are essentially talking about two core skill sets, right? And the thing that makes it work is going to be the ability for an organization to marry these two core skill sets. One is the engineering skill set. And a lot of these engineers have worked on these applications for years, have a deep knowledge of the workflow. And the second is the data science skill set, right? Which is, capable of deriving these insights and, making these applications really, really powerful, right? So the fact is that there are not enough people on the planet with both skills and the right balance of these skills. So the key to make it work is going to be the ability to build a team with the right mix of skills so that, we can deliver on this challenge. So there is tremendous opportunity in front of us, but, these are some of the core challenges that I see are going to be very significant for us to overcome if we were to make a positive.
Yes, absolutely. And How is CitiusTech positioned to help its customers efficiently and effectively use these AI and Gen AI products in their own fields, but also like in IT ecosystems as well?
Yeah, that's a very, very interesting question, right? And this is where, what I say that CitiusTech has a slightly unique position, right? And let me walk you down the history, right? CitiusTech, almost 20 years back, it started its journey as a very specialized niche healthcare interoperability and product engineering shop. And healthcare product engineering is something that is deeply rooted into how CitiusTech has operated and evolved as an organization. The way we induct, develop, and nurture our tech talent is all revolving around it, around the fact that we chose a very specific focused domain to work with and not be distracted by anything else. And the fact that we've been doing product engineering for our customers for years, right? We have very deliberately not ventured into, large scale application lifecycle management kind of work, right? And that helped us build that niche. Mm-hmm. Now, in the recent past, what I can also say is that CitiusTech has been able to invest significantly in building AI and Gen AI talent, especially over the last year and a half or two, right? And this isn't a combination with the history and the legacy that we have in healthcare product and the engineering that goes behind it, and the forward-looking, the whole AI and Gen AI bandwagon. The combination is not easy to find in the IT services space. And for me, most importantly, we have realized the challenges of integrating AI and Gen AI into core healthcare products. And that's why we have taken a shift left approach, which is a common terminology, right, in the software development lifecycle. But our shift left in this context is an approach to conceptualizing, right when we are talking about, ideation with our customers, to designing in our early architecture and design conversations, developing and testing of Gen AI enabled healthcare applications. Right? The right mix of skills, like I mentioned earlier, really makes it tick. So if you think that you can start an aspirational Gen AI application, and work on it in a vacuum, I have witnessed that, we have faltered early on, but then we have been able to do this course correction quickly. Engineering, Gen AI, and data teams, they had to define the larger problem at hand together, right? It's very important that they understand the overall problem statement. Then they go and address their own core problems, right? And solution for them. But then that has to be converged together in the larger workflow throughout the SDLC. So, the way I call it, that it is an evolved SDLC for Gen AI powered applications if we were to build them. And that is something that we are trying to make work at CitiusTech. We have managed to create a Gen AI engineering cookbook, as I call it, that really helps us guide such projects at scale, right? And avoid pitfalls, prioritize, questions and, the decisions that need to be made in time. Because, if you are going to take certain decisions, you are going to commit yourself for a considerable period of time, given the test cycle of these Gen AI applications, right? So I truly believe that CitiusTech is in a commanding position to catalyze adoption of AI and Gen AI in the healthcare product.
Oh, certainly. As you've mentioned, you're talking about the growth and the projects and all these new technologies and bringing people on board. It made me wonder, as somebody yourself who's been deeply involved with integrating AI into these applications, can you share a memorable moment or maybe a project where you saw firsthand the impact of AI on improving patient outcomes and also just the operational efficiency, like the whole package, really?
Absolutely. I must say that there are a couple of my favorites. And, from a feedback perspective, again, I want to state that is early feedback, right? And a lot of this is preliminary. And I do expect this to mature over time. And we are tuned for feedback, honestly, right now, right? And see what our end users have to say. But like I said, there have been a couple of exciting projects that I've been very closely associated with. Unfortunately, I'll have to abstract out some of the details for the sake of customer non-disclosure.
Sure.
But I would certainly share some.
Thank you.
One Gen AI use case is very prominent that we have implemented recently is in the whole EMR EHR application space. And we have been able to use the popular summarization feature, right? That Gen AI brings, which is something that probably we have been using day in, day out to make our life simpler, summarizing meetings and summarizing our day, all of that, right? With nifty tools like, Copilot, Q, and others. But in this particular case, what we have been able to do is, very visibly move the needle on physician productivity and quality of care by putting in front of our clinicians a summary of patients' last 5 visits or, clinical notes worth last few months in front of them, even before the patient actually shows up in the physician's cabin. Now, you imagine, right? Traditionally, a clinician with, a list of appointments and literally no time to breathe, right? Is as best as they can try to prepare for that day. But still, there is so much that's happening just in time, right? Where they are trying to, look up so much of this information to get the right context before the patient actually comes and sits in front of them in the cabin, right? So how did it happen, right? This certainly leveraged an LLM in the back end. But what I want to highlight here is what did it take for us to make it work in a mobile experience. So the clinician was actually using a mobile application, which is essentially the the EMR app that they generally use on their mobile phone or their desktop, right? So to make this work, we have to make sure that the EMR application is able to expose all the required data to provide the right context to the large language model to make sure we get the desired and very tuned outcome when it came to patient summary, right? The context was extremely important. And there was a significant effort that the team had to spend to make sure that they were able to identify the right, interfacing point for an end user, which is the clinician in this particular case, to seamlessly go through their journey or their task flow during it. The number of APIs that had to be built to expose the right quality of data and the tuning that had to be done was significant. Outside of the effort that was put in just on the Gen AI side of it, right? And the value this brings is evident, right? It ensures that the clinician has a much better context of the patient's medical history, and they will be far more focused on the conversation with the patient, right? Than trying to, navigate through a super complex EMR application that could take them going through 10, 15, 20 odd screens, right? Mm-hmm. Through a series of SOAP notes, historical data for them to get the right context for the patient, right? And I think, it is a very powerful use case that impacts everyone in the healthcare value chain because the patient has an elevated conversational experience with the provider. The provider for all the work saved in gathering the right context and, significantly positively impacting the diagnosis and the treatment, right? And there is another AI use case that I can actually share with you. And this is, particularly close to my heart because I'm very keenly interested in med devices is that, at CitiusTech, we have invested in building what we call a connected care solution framework. Now, the idea of this is to help our customers, accelerate their journey of building a connected, medical device ecosystem. And this is, disparate medical devices, right? So we have been able to build certain accelerate. And what we are trying to do here is bring in AI on the edge devices. So, generally in an acute setting, you will have, a patient. And on the bedside, you'll have multiple monitoring devices. And the patient may be, in an ICU or a ward or even in a ward setting for that, right? So here, constantly, there is a lot of telemetry data, clinical data that is, being generated by these devices. and it's humanly very difficult to process that data. And generally we are doing it for just-in-time data with whatever limited trends we have available. But what we've been able to do is bring AI on the edge, and the data that one of the medical devices, that is, say, monitoring the vitals of a patient, right, is producing, we are able to apply, say, computer vision, if it is video telemetry data or, waveforms, apply certain computer vision and, process that data and provide really valuable insights and suggestions to the surgeon or the clinician who is essentially, taking care of the patient, to be able to figure out how they can optimize, maybe the therapy that the patient is receiving, right? So it could feed, what is the infusion pump delivering to the patient in terms of drugs, right? And if they want to calibrate that dosage, right? So essentially bringing an ecosystem of connected devices to the forefront and see how we can make this ecosystem smarter, and how can we really aid a clinician in decision making and stay ahead of the decision making process, right? And be more proactive than reactive in this space.
Those are excellent examples, and certainly highlighting the whole chain, of everyone involved there. And I feel like as I was listening to those, everyone's had these sort of examples. So if they've gone to the doctor and not felt heard or had to re-explain themselves, and also like the frustrations of the providers being like, I'm just trying to stay on top of it and take care of my people and do what I love to do. And just across the board, those are great examples. So thank you very much for sharing those with us. As we wrap up here and reflect back on our conversation, and for you just reflecting on your experience with AI in healthcare, what looking forward to the future, what are some of these emerging trends and technologies that you believe will have the most significant impact on the industry? I know I could give a time frame and say 5 years, but that could be huge change. So I guess I'll just leave it open, just like the more immediate sort of future in the next few years. What do you see as the big change there?
Yeah, I mean, if somebody asked me this question 2 years back about Gen AI, I would have miserably failed at my prediction as to what it could do across the board, across industries, right? Not just healthcare. And that's why I'm going to be very cautious with what I try to predict here. But I think the space in healthcare is going to significantly mature over time, especially in the clinical decision space, right? The use case that I talked about with the med devices, right? Again, they are significantly aiding clinical decision. And I'm a fan of some of these TED Talks, right? And I was listening to this where, this lady talks about being, calling your day to be crazy busy, right? And which is something that we tend to do, right? And we feel overwhelmed and all of that, right? And one simple thing that she called out, right? And she's actually a doctor in an emergency room, right? And she says that, it's not crazy busy. It's about how ready can you be for things, right? And the fact that the number of decisions that you have to take in a day, really reflects on how exhausted you feel. And if you can minimize the number of decisions that you need to take, probably you'll be more and more productive, right? And take better decisions in life for yourself and for others. Right. And this is where I correlate this with, clinical decision, systems gaining the most from Gen AI, because with all the data that's available to us, historical data that has been captured manually, or all the data that these devices are capturing so fast, I think we are sitting on a wealth of data just to be harnessed. Mm-hmm. And once we kind of fine tune it and make it safe for everyone to leverage, I think we'll see the most benefit where, everyone will have a better life, whether it is a care provider with the number of decisions they have to take and the quality of those decisions that they take day in, day out, and how it eventually, impacts their patients and their families I think this is a single biggest thing where I would see a lot of value coming in the future with Gen AI and AI.
Oh, absolutely. What a great example there. Yeah, it made me think of some of these, the big names that you hear in just an industry, like Mark Zuckerberg, for example, and talking about how reducing the amount of decision making, like what I'm going to wear for the day. So you're just having basically the same shirt and same outfit that you wear day after day. But in the case of AI, being able to help assist in making those decisions to reduce some of that mental fatigue and being able to show up, I think that's I think that would be absolutely a huge value for people in healthcare. And so thank you. I didn't want to limit you down to a time frame of like 5 years, 3 years, because it changes so rapidly. But I think that's a perfect answer for across the board.
But honestly, CDS is so vast that I'm pretty sure that there will be an impact in a year, and there could still be impact coming over the next 2, 3, 5, 10 years. Right? I think it's an ever evolving and ever maturing space, and it is that how much can we trust machines to guide us through this, right? And I think we will.
Excellent. Deepesh, thank you so much for your time with me today. It's been such a pleasure talking with you. Thank you for bringing your expertise to this conversation. It's been wonderful. Thank you so much.
The pleasure has actually all been mine. Thank you so much for having me, Laurel, and look forward to connecting with you again. Thank you so much.
Thank you.
The Shaping Healthcare podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.